The client Rebecca Turnbull is a 20-year-old female. During our initial consultation, we discussed her schedule and lifestyle. She is a full-time university student who also works part-time. Her days are usually busy with early starts. Any program that is implemented needs to be flexible to suit her life. The client is currently a member at a local gym, but feels unmotivated to attend because she doesn't really enjoy going. She is hoping to find a new gym that is better suited to her needs, with classes that she will enjoy. Rebecca attends 2 dance classes a week. After joining a new gym, she also hopes to attend at least 2 gym classes as well. Her short-term goals include becoming more motivated to work out and becoming better at sticking to a routine. Other goals include increasing her cardiovascular fitness as well as increase overall strength and endurance. Rebecca would also like to lose weight. She explained that she had put on quite a bit of weight during and after COVID, so would like to get back to being within the 90 kilogram area. Long-term goals include sticking to a healthy lifestyle and maintaining weight loss. We discussed incorporating injury prevention exercises for dancing, as well as including core exercises to help engage and support posture for dancing and everyday life. Rebecca doesn't enjoy running, so to improve cardiovascular fitness, exercises will need to be specific to increase heart rate. The client has also indicated that she has previously suffered from back stiffness, but it hasn't been an issue in recent years. She also explained that when she was younger, she had bouts of exercise-induced asthma. To help prevent stiffness, back strengthening exercises will be added to the program. As for the asthma, RPE will be checked regularly throughout the program to ensure the client doesn't become overworked. This will assist in reducing the risk of any asthma flare-up. I chose a resistance hypertrophy style program for the client. This programming style aligns with the client's goals. Resistance training is the most effective method to increase muscle mass. It has been shown to promote many health benefits. Resistance training is commonly prescribed for skeletal muscle hypertrophy and strength development. It also promotes multiple health benefits such as improving cardiovascular function, muscle quality, and improving inflammatory response. According to Majanti 2021, another main benefit of hypertrophy training includes a decreased chance of injury. This is particularly important for the client in terms of her dancing regime. The high rep count and high intensity in a hypertrophy style program allows for quick neural adaptation. The body is exposed to a repeated movement pattern, which leads to the quickest response both neurally and physiologically. The high intensity range for this program will also correlate with increased cardiovascular fitness. Maintaining a high intensity range increases the heart rate. The test I chose correlated both with the client's goals and dancing regime. The client's primary goals are to improve strength and flexibility, which will help reduce injury. The 1RM testing was relevant for the client. I was able to select a weight for the testing based off the client's previous 1RM testing, which was done 4 years ago. The 1RM testing will help with exercise intensity prescription. Hypertrophy resistance works off a percentage of the 1RM. Calculating intensity ranges will be a lot easier with this score. The sit and reach test is associated with flexibility, which is the main component of dancing. This test is a simple procedure which is easy to administer and requires minimal skills training for its application. The order in which the client performed the test was an important factor. I administered the cycle test first because any cardiovascular endurance test should be performed first to ensure that the client isn't fatigued and can get the best possible result. I also chose to do the YMCA cycle test. The client doesn't enjoy running, so this was the main reason for this test selection. Flexibility testing should be performed on warm muscles and can be used to allow the client to recover before completing muscle strength tests. Muscle strength tests should be completed when the client is warm. I put the squat at the end because the client had complained of sore legs after doing the YMCA test, so I wanted to make sure that enough rest was given. Before starting the program, I performed a wellness check on the client to get an understanding of how prepared they were to work out. I assessed the following areas based on a scale from 1 to 5, with 1 being poor and 5 being great. This questionnaire was used to gauge whether I needed to modify the program, to understand if the client could be motivated to be pushed or try harder in exercises, or whether they needed more breaks during sets. It is a really simple, effective tool that can be quickly administered to better understand your client. A warm-up that is dynamic can improve athletic performance and also prevent injury. They are important movements where joints and muscles go through a full range of motion. The body and muscle temperature goes up, which increases the oxygen and blood flow throughout the body. The warm-up usually lasted 5 to 6 minutes and wasn't to exceed a 3 on the RPE scale. For the program, I chose to do a full body workout. The client has a busy lifestyle, so I wanted to make sure she was able to get the most out of each session. I alternated between lower, upper, and abs, making sure the exercise order always started with the largest muscle group first, lower body. The exercise selection was based on the goals of the client, which was to improve strength, reduce injury, and increase cardiovascular fitness. In week 1, I started with a low number of reps and 65% intensity based off the 1RM testing. I also only did 2 sets of each exercise. This is because of the time restriction. The client was not familiar with some of the exercises, so I had to demonstrate. We also spent a little time on correcting technique and creating cues that the client could remember for the following weeks. Making sure the client was performing the correct technique was the most important part of week 1. As the weeks went on, I increased the reps and intensity. I also progressed certain exercises because the client had adapted extremely quickly to them. Progressions that were made included bilateral to unilateral, plank to side plank, and Pallof press to lunge stance Pallof press. I regressed the back squat to a kettlebell swing. This was done to reduce the impact on the client's back. There was no pain, but I didn't want to aggravate or irritate the back and cause a flare-up. In terms of establishing healthy behaviors after the program and adapting to a lifestyle which implements exercise, there are certain aspects that have been discussed and implemented. The client joined a new gym throughout the program and has been doing 2 classes, boxing and cardioblast. She also still dances twice a week. So to complement these sessions, I have implemented a stretching and flexibility program that can easily be done at home. In terms of the client's goals to lose weight, I recommended that she seek advice from a nutritionalist regarding guidance with a food plan. We established that she didn't have a healthy diet, and to complement her new fitness regime, eating a healthy, balanced diet is necessary. It has been proven under the behavior change techniques that social support can help maintain and motivate clients. The client's friend also attends the gym. She has mentioned that it helps her stay accountable and motivates her to continue going. The BCT self-monitoring of behavior and outcomes of behavior has been recognized as an effective way of motivating clients. Keeping a diary will help the client set and maintain a strict schedule throughout the week. I believe that there are certain areas that I can work on to enhance my service delivery and improve my ability to manage clients. I need to broaden my knowledge regarding aerobic testing and understanding how to administer them correctly. I also need to become more versatile with ergometers, as I was unsure how to calibrate and set up the one that was available. In terms of autonomy, next time when creating the program, I would give the client more autonomy. This could be done by giving them options allowing them to choose. Autonomy creates accountability, which will more likely result in satisfaction and ultimately goal achievement. I need to broaden my knowledge in sport-specific exercises and develop an understanding of how beneficial they can be in terms of injury prevention and sports performance. This will help when or if I work with clients who are athletes or who play sport. I know that I need to become more confident. Sometimes even when I believe I have the right knowledge or understand something thoroughly, I still question myself. Backing and believing in myself is something I need to work on. This will help increase my confidence, which in turn will increase the likelihood of a client respecting me as a professional. When working with clients, it is important to build a close relationship to understand how best they will perfect an exercise technique. This is done through cueing. Cueing can be auditory, visual, or kinesthetic. Making sure I know the client well enough to know which cues will be most beneficial is an important factor in developing technique awareness. I constantly learn new things in this field, and I'm picking up on relevant tips and tricks from my peers, as well as my mentors. So reflecting on what I have done is an important part of this career. Thank you.